Okay, when we talk about acute neurologic events and spinal injuries, you have to know that every single second counts. Seriously, these aren't just topics you memorize for an exam. These are incredibly high-stakes situations where making the right call right away can literally change a patient's entire life.
So, imagine this. You see these signs: facial droop, paralysis, a seizure. What's going through your head? Are you just running through a long list of diseases, or are you cutting straight to the chase and asking the most important question? What is the biggest, most immediate threat to this patient's life and function right now? That's the challenge we're going to tackle. Because, confusing the signs of a seizure with a spinal cord lesion, or maybe missing those early subtle signs of Bell's palsy, that's not just an academic mistake you can brush off. It can have massive consequences for your patient. In these critical moments, being efficient can be absolutely life-saving.
All right, let's be honest about a huge hurdle that so many of us face: the memorization trap. It's really easy to just memorize lists of symptoms for a dozen different disorders. But guess what? Your exams, and more importantly your patients, don't care if you can recite a list. They test your ability to use logic when you're under pressure.
This slide really shows that crucial shift in thinking. The old way is just about naming the condition, but the CSMRN way, it forces you to ask the right questions. So instead of just saying, "Oh, that's Bell's palsy," you're asking, "Okay, is this problem in the nerve, the brain, or the spine?" Instead of just defining a spinal cord injury, you're immediately thinking, "What is my first move to stop this from getting worse?" See the difference? It's about moving from just knowing facts to actual clinical reasoning.
So, how do you actually make that jump from memorizing to reasoning? Well, this is exactly where the CSMRN clinical framework comes into play. Think of it as a mental model, a system to help you organize all that chaos of neurologic symptoms so you can figure out what you're looking at, and fast.
Let's break this down. Bell's palsy, we categorize that as peripheral. It's a cranial nerve issue. Now, seizures and spinal cord lesions, those are central, meaning they're starting in the brain or the spinal cord itself. And then you have your spinal cord injuries and fractures, which are traumatic. They're caused by some kind of external force. And this isn't just about putting things in neat boxes. This categorization is a game changer because it instantly tells you what to worry about. Traumatic, you're thinking stabilization. Central, protect that brain and airway. Peripheral, you're focused on more localized support.
So, once you've put the problem in the right category, the framework basically tells you what to do next. It's all about turning your assessment into immediate life-saving action. Let's run through a couple of quick scenarios to see how it works.
Okay, you walk into a patient's room and this is what you're told. This is a textbook presentation for a complete spinal cord lesion. Your mind is probably racing with a million things, but this framework brings it all into focus.
So, what do you do first? Your absolute #1 priority. Forget about the long-term care plan for a second. What do you have to do right now to keep this patient safe and prevent any more damage?
And here it is, the framework in action. Step 1, airway. Before you do anything else, especially with a higher level injury, you're watching that airway. Step 2, immobilize. You stop any further damage by making sure that spine is not moving. And then, and only then, do you move to step 3, assess. You start your detailed neuro assessment. Airway stabilization assessment. That is your flow. All right, let's try another one. This time a little more specific. We know the cause is trauma, and we can actually see signs of injury to the neck.
This builds right on top of the last scenario. When you see a cervical spine fracture, that neck swelling is a massive red flag for a blocked airway. So once again, your top priority is the airway. After that, you're focused on maintaining spinal alignment with every single movement, while you start your hands-on assessment. The framework always points you to the biggest life threats first. It's that simple.
So what you're seeing is the CSMRN advantage. It's not about trying to cram more facts into your brain. It's about having a formula, a system that just works every single time, whether you're taking an exam or you're standing at a patient's bedside.
And here it is, the formula for success. It's a 3-step process. First, you recognize the neurologic type. Is it peripheral, central, or traumatic? Second, you interpret the functional deficits. What can't the patient do, and what is that telling you? And third, you prioritize your interventions based on that information. That right there is the key to feeling competent and confident, both on your exams and in practice.
This whole approach is about being proactive, not reactive. It trains your brain to see the connections, to anticipate what could go wrong, and to step in before a small problem turns into a total disaster.
It's about preserving function and saving lives by always thinking one step ahead.
And really, that's what this is all about, isn't it? Whether you're clicking an answer on a screen or you're in a real trauma bay, getting it right and getting it right quickly is what protects your patient's function, keeps them safe, and ultimately decides their outcome.
Look, we've really only scratched the surface here. This was just a little preview to show you the logic and the structure, but the full in-depth framework for acute neurologic and spinal disorders, with every detail you need to really master this, it's all inside the guide. I definitely encourage you to check it out.